Well, while the holidays can be a time for celebration and festive fun, for many people, the holidays also bring stress, mood changes, and extra responsibilities. That leaves many people feeling down or experiencing the winter blues. Seasonal affective disorder is a type of depression that follows a seasonal pattern, typically worsening in the fall and winter months. So we have Dr. Holly McKenna with Dara Wellness to talk to us about what SAD, seasonal affective disorder, is, and kind of what we can do about it. So I guess first, what is it?
Yeah, so seasonal affective disorder is a type of depression. So it is what you would typically think of with depression, with low mood, maybe feeling kind of hopeless, low energy. It's a little different in that it really is like the winter months. Like during the winter months, we think of hibernation. So those are the symptoms that are more prominent. Things like sleeping a lot more and just kind of feeling like you really just can rest all the time, don't want to get out of bed.
Naturally, I know that you are very in tune with like our body's natural rhythms and stuff. Naturally, we do want to sleep a little more during the winter months, and there's not necessarily anything wrong with that.
No, absolutely.
It's when it goes too far.
Exactly. So there is that tendency, and I actually encourage folks to listen to their bodies, and maybe if you want to rest more and have more self-care in the winter, awesome. I think your body needs that recharge, like just like animals hibernate. But it can get to that extreme where you're like sleeping more often than not. You're avoiding things and isolating, like a hibernation, but to the point that you're like turning down things you'd normally enjoy.
Okay.
And then your eating patterns can change. Now, of course, we love to eat all our like winter sweets like we're gonna have in our next segment, but like really craving carbs to the point that it's like a lot of carbs, and just really, along with these other symptoms, with the low mood and not feeling joy and not seeking out or enjoying things you normally like.
Admittedly, my stress eating does increase this time of year.
Yes.
There's also an abundance of treats that make that.
I mean, they're kind of fabulous. So
they are. Okay, so if you think that you might be a little more than normal with your, seasonal affective disorder or depression, what can you do about it?
So there are different specific treatments for this. So, we always recommend therapy, and there is a specific cognitive behavioral therapy for SAD or seasonal affective disorder. And it focuses more on the thoughts that come up with the isolation and the not feeling like you want to get out and do things, and really kind of trying to do the opposite action of those things. And so it's encouraging you towards that. And that's super effective. There's also, because the cause of seasonal affective disorder seems to be related to the shortening of the days, like we have winter solstice coming up this weekend, and that's the shortest day of the year. So our bodies have less sun exposure, and that actually contributes to the cause of seasonal affective disorder. And so one of the therapies is light therapy. And it's at a brightness that's like 20 times brighter than what our normal indoor lighting is. And it's for 30 minutes a day, 30 to 45 minutes. That's under a doctor's supervision, because if you have a predisposition towards something like a bipolar disorder or mood regulation, it can make those things worse. You have to kind of do that with supervision. Also, vitamin D is something that we've realized is something that seems to be a component of this. So vitamin D specific replacement. And again, you'd want to do that with supervision, because you want to make sure you're kind of addressing it to the point that your body needs.
There's a lot of possible options. I have 100%. To imagine that people farther north, where the days are even shorter, the winters are even colder, probably have a harder time with this. Here, I mean, we have some 70-degree Christmases coming up for us.
I know, it's crazy, right?
So maybe just trying to get outside a little more, soak in that sunshine when you can.
Yes, because I mean, with the time change, if you're working like your regular, 8 to 5 job, you might be going into work and it's dark, and then coming out and it's dark. So trying to take those breaks during the day, actually go and get real sunlight in your face, that's going to be super effective when you're kind of in that space of, do I need to go see someone, or can I try kind of get myself out of this?
Try and get a little more sunshine. Dr. Holly McKenna always has the best advice. Thank you so much.
Absolutely.
All right.